Hi, my name's Molly. I'm going to be going through PPE, how to put on PPE and how to dispose of PPE. So first I'm going to go through my 8 pre-procedural steps. So I'm going to check the MAR, see if there's anything I need to gather. And then I will gather equipment. I will wash my hands. I will then knock on my patient's door. I will introduce myself. I will ask my patient for 2 forms of identification. I will also explain what we're going to be doing today. And I will raise the bed to hip level. I will also, I would have also provided privacy prior or right after asking for 2 forms of identification. And then going into PPE, first, like I said, I'm going to wash my hands. I will then be putting on my gown, and with the gown, I will be putting my hands in here, making sure that they go cuff to wrist level. I will be tying the back up top first. You want to make sure that when you're tying these, it's all twisted, tying these that you're tying both the neck and at the waist. After, so I'm getting this tied, after we do your gown, you'll be putting on your mask. So say my mask is right here. We're going to be putting them on from the straps, covering your nose and your mouth to go up and over your ears. Also, it's really important to fit the mask to your nose. So the metal piece, you push that in to center your nose. Then I will be putting on my eyewear. And so with eyewear, I'm going to pick up here and I'm going to put on the outside. And what you want to do is you want to make sure your goggles are on top of your mask. Next, I will be putting on my gloves. So here are the gloves. And with the gloves, I want to be touching the least amount I can possible. My finger stuck, that's okay. And what you want to do is you want to make sure to put it over your cuff so there's no skin exposed. So once that is on, I will ask for 2 forms of identification for my patient again. I won't be asking for 2 forms of identification. I will be doing my 2 ID checks. So then we're going to do our whole thing, what we need the stuff for, and then once we're done, first I'm going to dispose of the gloves first. So I'm going to pull the cuff, try not to touch anything, and dispose of them like this, again, from the cuff going out. Then I'm going to be doing my eyewear, and I'll be going from the outside and pulling out and then going down as well. Then I will be doing my gown, disposing of my gown. So I'll go untie them, and then I will lean forward and going from the cuff down to minimize touching. And then once it's off, I'm going to roll it into a ball and I will dispose of it. And usually it's disposed of in a red trash can outside the room or on the way out of the room. After that, after my gown, I'll be doing my mask, and I'm going to pull from the outside of my mask to take off, and I will put my mask into the trash. Last, I will be washing my hands. And then following this, I would be doing my 6 post-procedural steps. So with my post-procedural steps, I will be lowering the bed. Then I will be asking my patient if they have any questions or if I can get them anything. And then I will be disposing of my PPE, which I just did. I will be cleaning any equipment that I used. Then I will be washing my hands again. And last but not least, I will document everything I just did.